Most people believe that if a surgeon recommends an operation, it must automatically be the right choice. The doctor knows best. The hospital has the equipment ready. The paperwork is prepared. Just sign here. Many people go along with that idea without hesitation. But over time, patterns start to appear that are not always talked about openly. Some patients go in for routine procedures and come out facing unexpected complications, longer recoveries, or changes in their daily life that they were not fully prepared for. In some situations, families later say they wish they had asked more questions before agreeing. Not because the surgery was wrong, but because they didn't fully understand what recovery would actually involve. Not always worse outcomes in every case, but different outcomes than expected. The truth is, as the body gets older, it doesn't respond to surgical stress the same way it used to. Recovery becomes slower, and the margin for complications becomes wider. The immune system becomes less responsive, healing takes longer, and even small complications can take more time to resolve compared to younger individuals. The real question is not only whether the surgery can be done, but whether the body can truly handle what comes after it. My name is Dr. Liam Cooper, and I want to walk you through 6 types of surgeries that can carry higher risks for people over 60, so you can better understand what questions to ask before making any decision. Before we begin, think about this for a moment. 2 people can go through the same surgery, but have completely different recoveries. And often, the difference is not the surgery itself, but the overall condition of the body going into it. Now let's start with the first category. Open heart surgery is one of the most serious and common major procedures performed on older adults. In many cases, it can be life-saving and necessary, especially when arteries are severely blocked. But it is also one of the most physically demanding procedures on the body. During this operation, the heart is temporarily stopped, and a machine takes over the work of circulating blood and oxygen. For a younger, stronger patient, this is usually well tolerated. For older adults, especially those with kidney issues, diabetes, or overall frailty, the stress can be significantly higher. Recovery is not just about the surgery itself, but also about how quickly the body can regain stability afterward. Some patients may require extended time in intensive care, while others may take weeks before they feel even partially back to normal. For example, some older patients expect to return to normal activity within a few weeks, but in reality, recovery can take much longer depending on overall health and existing conditions. Complications such as stroke, kidney strain, prolonged ventilation, and extended confusion during recovery become more likely in higher-risk patients. That is why, in some cases today, less invasive procedures like catheter-based heart treatments are being considered as alternatives. In many situations, simply asking whether a minimally invasive option exists can open the door to treatments that involve shorter recovery times and fewer complications. Now let's move to another type of surgery that is very commonly recommended. Spinal surgery is another procedure often recommended for chronic back pain in older adults. Back pain is extremely common with age, and many people are told surgery will solve it, but the outcome is not always as straightforward as expected. In some cases, spinal fusion or multi-level surgeries involve hardware being placed into the spine to stabilize it. While this can be necessary in severe nerve compression, for general degenerative pain, results can vary significantly. Some patients expect immediate relief, but recovery can take months, and improvement may be gradual rather than dramatic. For example, a patient may go into surgery expecting complete pain relief, but still experience discomfort afterward due to other underlying spinal changes. Some patients experience limited improvement, while others face complications such as infections, blood clots, or strain on adjacent parts of the spine that were not operated on. Because of this, non-surgical approaches like physical therapy or targeted injections are often considered first when appropriate. Strengthening surrounding muscles, improving posture, and reducing inflammation can sometimes provide meaningful relief without the need for surgery. Now let's talk about a category that often brings urgency and emotional pressure. Major cancer surgery is often approached with urgency and emotional intensity. When people hear the word cancer, the natural reaction is to remove it as quickly as possible. And in many cases, surgery is absolutely the right choice. But the goal of treatment is not only removal of disease, it is also preserving quality of life. Some cancer surgeries are extensive, involving long operating times and significant recovery demands. In older patients with other health conditions, recovery can sometimes be more challenging than expected. In certain cases, the physical toll of surgery may lead to prolonged weakness, weight loss, or reduced independence during recovery. For example, some patients may spend weeks regaining strength after surgery, requiring assistance with daily activities that they were previously able to manage on their own. That is why it is important to understand all available options, including radiation, targeted therapy, or careful monitoring in selected cases. A balanced discussion with a specialist can help determine whether surgery offers the best overall outcome, or if another approach may be more suitable. Now moving to one of the most common elective procedures. Hip and knee replacement surgeries are among the most successful procedures in modern medicine. For many patients, they restore mobility and independence. However, in older adults with multiple health conditions such as heart disease, diabetes, or reduced mobility, the risk profile changes. Complications like blood clots, infections, or delayed recovery can become more likely, especially if overall physical strength is limited before surgery. Recovery after joint replacement also requires active participation. Physical therapy, movement, and consistency are essential for regaining function. For example, patients who are not physically active before surgery may find it more difficult to complete rehabilitation exercises afterward. Patients who are not physically prepared before surgery may find recovery more difficult than expected. That is why preparation of the body before surgery, sometimes called prehabilitation, is becoming increasingly important. Even small improvements in strength and mobility before surgery can make a meaningful difference in recovery outcomes. Now let's discuss a situation that is not planned, but happens suddenly. Emergency abdominal surgery is different from planned operations. It happens suddenly, often due to conditions like internal bleeding, ruptured organs, or severe infection. There is usually no time for long discussions or preparation. In older adults, the body's ability to respond to sudden stress is reduced, which can make recovery more complex and unpredictable. These situations often involve multiple organs being affected at once, which increases the overall strain on the body. For example, a condition that starts with mild abdominal discomfort may quickly become serious if not treated early, leading to emergency intervention. Early recognition of symptoms and timely medical attention can make a major difference in outcomes. Ignoring warning signs or delaying care can allow conditions to worsen, making emergency surgery more risky than it might have been if treated earlier. Finally, let's look at another important category. Another important category to understand is lung surgery, particularly procedures where part of the lung is removed due to tumors or disease. While lung surgery can be necessary and life-saving, it also reduces overall breathing capacity permanently. For younger patients, the body often adapts over time. For older adults, especially those with existing lung conditions or a history of smoking, recovery can be more difficult, with increased risk of infections and reduced stamina in daily activities. Simple tasks like walking longer distances or climbing stairs may require more effort after recovery. For example, some patients notice they become fatigued more quickly during everyday activities after lung surgery. In some cases, less invasive treatments such as targeted radiation may be considered depending on the situation. Discussing these options early can help patients understand whether surgery is the only path or if alternatives may provide similar benefits with less physical stress. Now that we have covered these 6 categories, the most important thing to understand is this. Surgery is never just a technical decision. It is a personal one that should take into account overall health, quality of life, and long-term recovery. Before agreeing to any major procedure, it is always important to ask clear questions about risks, alternatives, and expected recovery based on your individual condition. You may also want to consider practical factors, such as support at home, the ability to attend follow-up care, and how recovery may impact your daily routine. For example, having family support during recovery can make a significant difference in how smoothly the healing process goes. And most importantly, never rush such decisions without full understanding. My name is Dr. Liam Cooper. This content is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your qualified healthcare provider or doctor before making any medical decisions. Every patient is unique, and only your doctor can guide you based on your specific medical history and condition.